participate in our future cares as a doctor. Because if we do not align with the North American way of doing things, we won't be successful in residency.
So you're finding, so I'm just trying to reword it for you. So you're finding it's learning the soft skills.
Definitely.
Right.
Definitely. Because the academic skills can always be trained. They're all on the textbook, on the guidelines. I can search in a minute on Google. However, communication skills, ideas, philosophies, those are the things that are hidden behind the textbook, which should be discovered and taught by one great teacher, not by someone that just say, okay, you do this and you do that. No, that's not how it works.
Absolutely, I agree with him. Yeah. When you get a guy who's been abusing alcohol and tobacco for a number of years, it's very difficult to get him to quit. A lot of people, after a few tries, normally give up on them. And Dr. Trent has never done that before. It doesn't matter how many times this guy decided, I'll think about it. He always talked to him. Setting up ideas in his head, talking to him. What's more important in your life. He asked these questions, and they get the guys start to think. Some of them did quit eventually, so that's wonderful.
So I have one for you. It's kind of personal, but it's okay. I'll ask anyways. How do you convince somebody dealing with mental illness? Have you encountered that yet? Mental illness or depression?
Okay.
To seek help, because Asian communities in particular
Absolutely.
have
Yes.
kind of a...
It's like a taboo to be associated with.
I think even in the Western world, even Western civilization has, like everybody has kind of an issue with dealing with mental illness as a group, right? But I think even more so Asian communities kind of have more stigma with mental illness. And so
Absolutely.
have you encountered that? Sorry, if you haven't, then it's okay.
Well,
It's more
Richard, you want to add anything?
Well, I can say one example. I mean, if you want to take it in the video, then that's fine. I mean, it's not a great example though.
Oh, okay.
Because I think I think this is one case of a female patient who just gave birth to her daughter. So postpartum depression. Actually, first it's like 2 weeks just blue, and then goes to depression phase. So I've seen her twice with Dr. Chen, and each time Dr. Chen is spending at least 15 minutes with her to explain things, because usually Dr. Chen only spends about 5 minutes with each patient. I mean he is really efficient type of guy. Not the 5 minutes just to throw things away. Okay, in the 5 minutes he's already sufficient enough to give the patient what they want. But he is willing to spend 15 minutes with this female patient about how to deal with depressions. And he's also giving out advices on maybe going back to China would be better, finding support from the parents back in mainland. And I mean, those are really supportive, because the patient was not really have a, how do I say this, like a secured feeling from the other psychiatrist, because the psychiatrist doesn't speak Chinese. So Dr. Chen is actually the one who does the comforting. Yeah. So I mean, we are not experts on psychiatry, but the atmosphere in the clinic is really comforting for that patient. So I think that's one thing. Like I said, Dr. Chen is really good on communication skills. For different patients, he knows how to customize for individual needs, and I think that's one vital skills for physicians, not even in psychiatry, but it's pretty important in psychiatry that we have to communicate. We have to spend time, and I think spending time, caring, and what else? Pinpoint the root of the problem of the mental illnesses is the key to cure people with mental illnesses. I mean, even for serious ones, well, they have to go to like a institution, right? But for light ones, clinics.
Sorry to drop that on you. I just
I'm just sharing my thoughts, because this one is really one difficult question to answer.
We'll talk about that later. Is there anything else that you wanted to add?
To what?
to this conversation, to the video?
Well, I think CPAC is doing a great job. I mean, I wasn't get to know this program like before I even came back. My mom gets to know it through RBC, and Lily was really helping. And the best thing about this is a. Am I turning this correct? Is this a non-profit program, right?
It is.
Okay, yeah. So a non-profit program is one great thing about CPAC is doing, because this is truly a contribution to the communities. And by forming such a mentor-mentee program, we get to meet each other in the same needs. I have met Dr. Zhang, who is also a mentee of Dr. Tran before, and she is succeeded in obtaining a family physician position in Canada, and she's now practicing under Dr. Tran. Really successful lady. And I got to see her, I got to see other mentees of Dr. Tran, we can communicate. So CPAC is not only showing us the connections to doctors in Canada, but also showing us connection to people who are in the similar situations, so that we can, we can fight for our future together. It's a really motivating experience. Yeah. Should you add? I mean, my
Well
words
said.
are not that organized.
Well, I think
It's all like improvised.
we're good, right?
Yeah. Very good stuff, guys.